is a complex joint. It is supported by multiple structures like ligaments, muscles, capsules, tendons, etc. to provide mobility in multiple range. But mobility has its price, and it comes in a way of pain, instability, and increased risk of injury. Hi guys, I am Meghna, and in today's video I'm going to share with you some common reasons because of which you can get shoulder pain. And if you are new to this channel, please consider subscribing to this channel, because every single week we come up with videos that's related to your health concerns and helps you manage the health concerns in a better way. So let's move on to some common reasons because of which you can have shoulder pain. Shoulder problems fall into 4 categories basically. The first one is the inflammation of the structures surrounding the shoulder. These could be either muscles, tendons, ligaments, etc. Second reason could be the instability of your joint. Third reason is the fracture of bones. And fourth is arthritis of joint. There are also some less common reasons because of which you can get shoulder pain, but these are some serious ones like tumors, infection, or some nerve related issues. In today's video, we are going to talk about some common reasons of shoulder pain, which comes under first 4 categories, that is inflammation, arthritis, instability, and fractures. So coming towards the inflammatory conditions. Now there are multiple structures surrounding your shoulder joint which can get inflamed, which can lead to shoulder pain. Out of which the most commonest one is also called as adhesive capsulitis or frozen shoulder. Frozen shoulder is a condition when there is inflammation of the capsule and synovium, which are the structures that surround your shoulder joint, which leads to difficulty in the movement and dull kind of pain that all constantly stays around your shoulder joint. The patient usually explains this as a dull aching sort of pain, making it difficult to move throughout the range of motion. Another common inflammatory condition related to shoulder is bicipital tendinitis. In this, patient may experience a deep throbbing sort of pain, especially in front of your shoulder, which happens due to repeated microtrauma to the biceps tendon. Bicep tendon is a structure that lies next to the bicep muscle, which is a muscle that surrounds your arm region. Extreme repeated movement is one of the major reasons because of which you can get this bicipital tendinitis, but one more reason related to this is aging. The next problem is rotator cuff tendinitis. Though it might sound very complex term, it basically means is an impingement or else inflammation or injury to the structures that surround your shoulder joint. Now this is very commonly seen on people who perform unrepeated overhead activities like swimming, tennis ball, volleyball, etc., or else who sleep in one position for a longer period of time. Now what happens here is when the shoulder blades put constant pressure to the muscles and soft tissue surrounding your shoulder joint, they get rubbed, causing microtraumas and inflammation. You might experience pain that develop on a gradual basis. Patient can also suffer from clicking sound, difficulty in raising arm after certain extent, in reaching to the back, and also finding it difficult to sleep at night. Myofascial pain syndrome is another problem that leads to shoulder pain. It's a syndrome that's characterized by pain, tenderness, and spasm of the muscles surrounding your neck and shoulder. There is very common association with stress, anxiety, tension that leads to the problem called as myofascial pain syndrome. Supraspinatus tendinitis. Now again, the term might sound very complex, but supraspinatus is basically a muscle that lies on the upper side of the shoulder blade bone. When there is inflammation of this muscle due to repeated activity, it leads to the symptoms of pain in the shoulder. The next type of inflammation is inflammation of infraspinatus muscle, where the muscle gets irritated and inflamed because of repeated activity and microtraumas due to poor postural habits, repeated movements, or injury, leading to the symptom of pain. Problem is subscapular tendinitis. Here the muscle named subscapularis, which is also a part of the scapula bone, or else called as shoulder blade bone, gets affected because of repeated microtraumas, leading to the problem of shoulder pain. Next common problem is called as subacromial bursitis. Now subacromial bursa is a structure that surrounds your shoulder joint, reduces friction there, and enables a seamless movement of the shoulder. When there is inflammation of this structure, it also leads to the symptom of shoulder pain. these were all the inflammatory causes because of which you can get shoulder pain. Now let's move ahead and see instability as a cause of shoulder pain. Now, instability of a shoulder joint is also one of the most common reason that leads to emergency visits to hospitals. There are a lot of people who get repeated shoulder instability episodes, which is because of lack of strength of the muscles and also due to repeated movement that leads to poor stability of the shoulder joint. Now, there are people who get this shoulder instability episodes following fall. What happens at this time is the joint gets dislocated, leading to a constant and severe symptom of pain. Next category, which is a causative factor for shoulder pain, is arthritis. Now, arthritis is something that is age related and worsens over time. It could be because of previous history of trauma to the shoulder, or else because of just some wear and tear activities, or else if the person is involved with some massive type of sport activity. Rheumatoid arthritis is also one more type of arthritis that is responsible for cause of shoulder pain. Now, this is a very different form of arthritis from other arthritic pattern, which is very commonly seen. Here, it is an autoimmune disease that causes pain symptoms among various joints of the body. Fourth category causing shoulder pain are fractures. Now, fractures are basically broken bones that causes severe pain, swelling, numbness and bruising to the area of injury. Now, this is a leading problem because of which the emergency visit happens where people need immediate medical care. So guys, in today's video, I tried to cover some of the common reasons because of which you can suffer from shoulder pain. Here, the idea is to give you an overview of why the shoulder pain can happen to you, and it's utmost important for you to get it diagnosed if you are suffering from shoulder pain. Because unlike neck pain where the cause is very postural, shoulder pain could be because of some major issues within the joint. So it's a good idea to see a healthcare professional and get it corrected very soon. See you next week. Bye-bye.